once again. And today's topic of discussion is how do you go about facilitating a program. So as I said that because it's a master trainer program and we need to really thoroughly know how do you go about uh, running a successful program and also facilitating a session so that when you do your training programs for your fellow professionals, you know what are the things that can help you in facilitating the program in a successful manner. So if I may ask you, so right now, do you do any planning or any, premeditation before you start with the program? And what are things that you normally keep in mind? Maybe you can unmute and speak if you want to answer this question. So what are the things that you keep in mind when you are going to facilitate a program? Especially those of you who are in training, I think we have a couple of people who are extensively into training. So what are the things that you keep in mind?
The time and audience.
Mm-hmm. That's important, time and audience. Okay. What else?
Upskilling, like as I said.
Yeah, that's usually one of the purposes that you wish to make a mention. Topics, okay. Okay. You take care of the topic. So we are still on the designing part you're talking about. What I'm trying to say, okay, let me rephrase my question. See, we sometimes we call it a training program or a teaching program, or now I'm talking about facilitating. I'm constantly using this word that you have to facilitate a program. So what is the difference between the two? If I say the difference between teaching, training, and facilitating, what is the difference? What is teaching and what is training and what is facilitating?
Dr. Indu, teaching is more monotonous.
Mm-hmm.
It's more like in school where the kids are going. The teacher is teaching there that she has to teach them the spelling of apple. She's only focusing on apple. But because here the learners are completely new and she has to feed that data into their brain. The concept of teaching is there, and facilitation is like where I already know that apple is APPLE. But now here I have to teach them like they already know apple, but why it is known as apple, why the apple is being introduced, how that sound, phonics and all is involved there, where the audience know the topic already, and where we are just enhancing their skill to the next level via interaction. So it is more into interaction. Interactive learning is there, like in facilitation.
The audience is actively participating.
So honestly, ideally, even in teaching, we all have realized that if it is when you are able to engage your students. So if I go by the definition Santoshi is giving us, so it's more with the students we use teaching. But now there's a realization even in teaching, when you engage your audience, you get better results. You get better learning outcomes. So if I go any other explanation, let me see in the chat box. I can see some answers. Dr. Amrit says facilitating is more result oriented. Dr. Amrit, I think even teaching is result oriented. Whether we achieve that result for everyone or not, that is different. But then that is also result oriented, and others understanding and using it for their benefit. Okay. Any other understanding if somebody wants to say? Okay. Sneha says training is about competence and skill and not just knowledge. Yes, I agree with you. So teaching is more about knowledge. You are giving the baseline knowledge. Whereas in training, you are upgrading their skills, or you're helping them develop deeper understanding. Like Santoshi said that they know about it, but you're creating deeper understanding.
Facilitating.
Sorry?
Ma'am, facilitating means making it easier for people to understand and then execute what we want.
So facilitating is not only making it easier, but actually facilitation believes that the person already knows it. And if it's an adult audience, you cannot teach them, because when you want to change somebody's knowledge base or skill base, you really need to create that environment where people are ready to learn and imbibe new things. And with the adult audience, we all know you cannot, switch on any button and teach them, because you really require their participation. So in facilitation, like Sneha has written, facilitating is you are directing where the session is going and you are not giving the content. So as a facilitator, you will just create an environment where the learning happens. Where the learning happens. So therefore, I'm repeatedly using this word facilitation, because you are going to be dealing with adult education, with an adult audience, and you cannot teach or train them. So for example, if you are even trying to introduce a new topic to your fellow professionals or even with your senior, you can't tell that, okay, you don't know this and I'm going to tell you this. We believe they already know it. So whatever I'm sharing with you in the program, most of you know everything. Only thing is I'm making you not only understand, but value. And then somewhere I'm hoping that you will be apply this in your day-to-day functioning and also transfer this knowledge to others. Okay. Santoshi has written that it's the content with recent guidelines and update. And then Dr. Amrit says more motivation. Yes, definitely. You need to create that motivation in your people. So normally I like Socrates, definition that says that you cannot teach anyone anything, but you can only facilitate
them think.
learning by making them think. By making them think. So right now also when I'm doing program with you, I cannot teach you anything. I cannot train you into anything. But if I'm able to create that, work as a catalyst and create that environment where learning automatically happens. So it flows in, then it is facilitating. So today's topic is all about facilitation. We are going to be learning the finer details of facilitation. A lot of it you may be already knowing, and then there will be some new learning simultaneously, definitely. And then we'll also try to understand how is it different to facilitate programs for adults and for anybody else, for younger age, like kids or anybody else. So adults have a very typical way of learning. And if we understand that, then we will make sure when we are designing a program, we keep that in mind and we integrate that in the delivery of the program. So we are going to talk a little bit about that also. Then also, what are some of the things that we should keep in mind when we are facilitating a program? We are going to talk that part also. And then also, how do you make, how do you facilitate, what is the overall format of the program, and how do you segment wise all that is going to be part and parcel of the discussion that we are going to have. Besides that, we are going to actually cover, so what are the qualities of a good facilitator? So how do you really create that good facilitators virtues in you? We will try to cover those parts, those aspects also. And then as I said right in the session 1 and 3 also, that you will come across audience who are disrupting, who unknowingly or knowingly act in a manner that actually disrupts your flow of the session. But as a facilitator, it is your duty to make sure that that doesn't happen, because otherwise the whole purpose of this session would go haywire. So how do you handle disruptive audience? Even that part we are going to discuss, because that's another important aspect of facilitation. So going further, let me quickly start with the screen sharing, and then I take the discussion further. I have small presentation and simultaneously we'll be discussing those points on that. Give me 1 second to close this. So is the screen visible to all?
Yes, ma'am. Yes.
Thank you.
Yes.
Sorry, it's taking a couple of seconds to load. Yeah. So after this session onwards, we'll be focusing on the clinical communication topics. But these two sessions we planned to integrate in the program because we need to really work on the training skills as well. So we have discussed about the difference between teaching, training, and facilitation. Actually, these are the factors that we need to consider that will help us in deciding that what will work here. So the purpose of teaching, training, and facilitation is very different. Pedagogies you use are usually very different. In facilitation, you have pedagogies where people get involved and engaged and then they participate. The group type is very different. Usually for facilitation, you will have adult audience, professionals, educated people. Group size also varies. We normally prefer a small size group in facilitation because we know we have to work one-on-one with the audience. So you normally would keep a small size audience. Otherwise, I mean, if you conduct a seminar or a webinar, you can have a larger, audience also. Then, of course, involvement is very different in teaching, training, and facilitation. So the role is very different of the person who is facilitating. In teaching, you are acting more like a teacher. In training, you are a trainer, and facilitation, you are a facilitator. The approach is very different. In teaching, you are mostly telling and imparting knowledge. And whereas in training and facilitation, we are asking and listening and making people participate. Okay. This we have discussed, and I think this is the approach you have to keep in mind when you are, planning or designing a program or a session. That spoon feeding will not work. Finding forwards and saying something will not work. So you just have to kind of create an environment where people are ready to participate and contribute. So facilitation is a technique that will help learners to discover, acquire, retain, and apply knowledge and skill. So you can see it's not like teaching regular teaching. So facilitator actually plays a very interesting role. The facilitator facilitates the learning by arranging the content and delivery in a manner where the audience or the participants become curious. They get interested and they start discussing and start reflecting. So you can see that it's the people who will be actually creating an environment where the actual learning will happen. And then facilitator takes steps to enhance the experience of the learner. And in case the facilitator has some information to give or some information to impart, so a facilitator would look at the right opportunity and suggest information at that point of time, because there at that moment the receptivity will be excellent. So if I may ask you, how is adult learning different? Write in the chat box. Please write in the chat box. You need to write just keywords. You need not write the detail this thing, but just what is the difference? How is adult learning different? Write in the chat box, please. Okay. Adults don't have clean slate and they are opinionated. Agreed. I absolutely agree with you. Dr. Priya says need for interesting presentation. Yes, because you need to engage them. That way, I think for everyone, they need something very interesting and that they can engage with. Dr. Santoshi says adult learners have their own opinion. Yes, like similarly, Dr. Amit said that they already have some learning, right or wrong, it doesn't matter. But then you have to really help them, correct their learning or unlearn something. Okay, interested only if useful to their scenario. Yes, so that means you have to make sure that your program or your session actually is able to create interest in them. Absolutely, I agree with you. Then adults have already learned things in their own manner. So that means there's already a learning. So it's not this new learning. So it could be actually some previous learning, which probably sometimes require unlearning and then relearning. Yes. Yes, Dr. Manisha, you have also mentioned the same point. Adults have to unlearn a lot of things because they have learned all their life, so they need to unlearn. Dr. Sneha says they need respect. Yes, so with adults, we have to keep in mind that you cannot engage them without nurturing their self-respect and nurturing their ego, you can say, or looking after their needs. Absolutely. Then Dr. Kundan has written feeling, I already know too much. Yes. So prejudice, likes and dislikes about particular topics, strong opinions. So that means these can either facilitate this session or they can interfere with this session. So you have to be mindful of this fact. Absolutely. Okay. Dr. Priya says you need to have an engaging session to involve them. Absolutely. So that means engagement is a very important thing. Okay. Dr. Deepika says adults will have more distractions because they are mind wanders. Absolutely. Then more experience impression. Yes, because they already have some learning. Active engagement is must. Yes, I agree, Dr. Sneha. They have, what is this, Dr. Manisha? I'm sorry if you could correct. What exactly is this?
Sorry, the P didn't get. They have
Okay,
their own
perception. Yeah.
perceptions. They have their own perceptions.
Mhm. Absolutely. So their opinions, their perceptions are already formed. That might facilitate your your topic, or that might interfere with it because if it is not in alignment with that. Then prejudices as learned skill and practice. Yes. So that means these would interfere with your delivery. Yes, Dr. Neha, I agree. Difficult to change your own learning because it's not easy to, let go of what you think is right or what you have been doing. Yes, Dr. Manisha has also brought up the same point. They're more rigid, especially if it doesn't go with their belief system, they will not accept it. If they don't agree with it's very difficult for you to, align them with you and agree with you. Then they
Ma'am,
expand. Yes, please go ahead.
yeah, I just wanted to say, because they have worked with a certain way which has worked for them for a long period of time, it is difficult to make them understand. So needs lot of backup with what you say is research,
Yes,
uh,
evidence. You have to
evidence
provide evidence
proof.
to
Yeah.
counter their opinion. Absolutely. So their frame of reference is already formed. Their definition of right and wrong is already formed. What should be done but should not be done is very clearly formed for them. So to make them change that opinion, you really need to have a lot of evidence and way where they not agree just because you are saying this, but they feel that yes, I can consider what you are saying. So that's very important. And then our views can be challenged. Yes, audience can challenge your opinion or whatever information you are sharing, and then challenging their opinion is also not easy because they are not going to easily accept because we like to believe that what I'm thinking or believing or thinking is right, and that is the way of life. So if you are challenging that, you can well imagine the kind of struggle that you will have, getting them on with you. Wonderful. I think these are wonderful examples. So all this we have tried to, sum up in number of, you can say acronym. So one acronym that, okay, there's something in the chat box. Let me read. Okay, make them curious. So that means creating interest and curiosity can help you engage them. Absolutely. So if we want to really make a good session or a good program, that we need to understand how do adults learn or what do adults require. So Sneha has mentioned that audiences is usually more heterogeneous, more cadres compared to children. Yes, so that means you already have people with well set personalities, well set thought processes, well set beliefs. So you really need to have a way of delivery where you respect all that, and then you are still able to foster their learning. So as I said, adults, they learn differently. So let's understand what all we should keep in mind when we are planning a program, planning a session. So the first thing that I want to bring in here is the difference between awareness and consciousness. So what exactly do you understand with what I've written? What is the difference? What is awareness, if I may ask? And what is consciousness?
Having knowledge about something, ma'am.
Okay. That's awareness. Yes, Mamta. Thank you for that. And what is consciousness? What is consciousness?
How we feel, like to react to
Being aware.
Being aware. And then that is awareness. That is awareness. That is awareness.
being mindful is consciousness.
Being mindful is consciousness. So
Ma'am, awareness is
Ma'am, in
dependent on
response to
consciousness.
awareness,
I'm about to explain the difference between the two.
Knowing that you know, probably. Knowing that you're
Knowing
aware.
that you know is awareness. So in this
But
picture, you can
conscious-
see, give me a
Ma'am.
second to explain. Then probably we'll have more clarity on it. Then
Consciousness.
so
Consciousness is just a mental state, but
Uh-huh.
to be aware, we
Uh-huh.
need consciousness. Then only we will be aware for that particular thing.
Okay.
So consciousness, as we say, that the person is oriented to person, time, and place.
So it's not. It's probably we let me explain you this, and then you'll have more clarity on it. So this board we usually see, when on roadside. What exactly does this board say? Often we see this kind of board.
this shows that there is a zebra crossing where the people will walk and will cross the road. So the sign
Pedestrian crossing.
is making them aware. The sign is put to make the
Dr.
people
Manisha,
aware.
hold on. Dr. Manisha, hold on. My question was, this board says what? So most of us know that this board is probably saying that there's a
Making
pedestrian.
conscious.
Give me 1 second. We are jumping to the conclusion. Allow me to conclude. See, this board, most of us have an idea that this board is probably saying either there's a school ahead or there is a pedestrian way ahead. That is awareness. Most of us know. Those who are into driving, those who know about the meaning of the roads, we all know that's awareness. How many of us drive carefully to make sure that we slow down, or we look left and right to make sure that we don't hit any child on the way? Because there's a school, so there could be school children around, and we need to be very careful not to harm anybody, and we slow down. That is consciousness. So awareness is knowing, and consciousness in this context is applying that knowledge. We are all aware. Whatever I'm telling you, I think we all know. And this is nothing new that I'm sharing with you. But consciousness is how many of us are actually applying that knowledge in our day-to-day work. So among adults, among your audience, you will see, if you'll ask them a question, almost everything everybody will know. But how many of them are actually applying that knowledge in their day-to-day functioning? That is something to be considered. So we all know that we need to treat our staff and subordinates with respect. But how many of us are actually doing that? How many of us are actually practicing that? That is the question to be asked. So you will see there'll be a lot of awareness, but consciousness would be not as much as the awareness. And among adults, this is a very common thing. So when you'll ask a question, you'll get a lot of answers from them. Second is adults, and not only adults, I think all of us have different learning style. We interact with the world with different senses, and some of our senses are primary way of interacting. So I had shared a questionnaire with all of you. I hope you have taken that questionnaire. Have you all taken? Anybody who has not taken the questionnaire?
I think Dr. Indu, I missed probably. I probably don't remember. I mean, when
It's okay.
was
I posted it today morning actually.
okay? So because I was going to the hospital and everything, and so I have
Good.
not opened.
It's all right. It's all right. How about others? Have others done that?
Yes, ma'am.
Have you done it? Have you done
Yes,
it?
Yes, ma'am. Yes, we shared.
yes.
Okay. So what
I
is
too missed it. I missed it.
I missed it.
okay. So that was basically to help you know your own primary way of interacting with the world. Your primary, identification way. So if you quickly have a look at the questionnaire, it is there in the group. I have shared in the group. So this is identify your primary representation system. So how do you really go ahead, interacting with the world? So if you look at your answers, some of you will be having highest number on A. So if you count the number of A's and count the number of B's and count the number of C's, you will have 3 different scores. Mamta, have you done it?
I have done, ma'am.
Okay. So can you count the number of A's and B's and C's for you?
Yeah.
So how many of you have highest score on A? Okay, Deepika has highest number on A. How about others? Or you could write your scores in the chat box with a comma in between A, B, and C. Let's see. Write your scores in the chat box. By the way, why are others not having their cameras on? Because unless you have a lot of people around, your energy to interact goes down. So I request everyone to stay connected and have their cameras on. Dr. Aparna, have you done the questionnaire? Have you taken the questionnaire?
I'm looking at it. I'm looking at it right now. But then I
Okay.
guess I need to really read properly, and
No, it cannot be done now. You will not be able to do it. So
I won't be able to complete it right now. Okay,
I
so
request everyone to do it because that will help you know your own, primary senses that you use to interact with the world and how you represent the world internally also. So some of us are auditory learners. Some of us are visual learners. So between my husband and me, he's very fond of explaining. If he goes somewhere, he would come back and he would tell me, oh, I went to this friend's clinic and this is how he has built the clinic. You enter like this, on the left there is reception, on the right there is this, in front it is like this, and this is. I am incidentally a visual learner. I need to have things in front of me to understand. So if you want to tell me, about something, you have to draw and explain me. So he verbally tries to explain me. I am a visual learner. There is huge conflict. There's huge conflict. It leads to a lot of frustration for me when he explains me about a place that he has visited. Similarly, some of you will be auditory learners, some of you will be visual learners, and some of you will be, emotional learners or kinesthetic learner where you want things to interact and do. So I can see the answers in your chat box. So Dr. Priya has, for example, written A is 6, C is 7, and B is 2. So that means C is highest, Dr. Priya, in your case, and even A is very close to 6 or 7. So as I said, A is visual learner. So if you look at the answer, for example, when I'm anxious about an outcome, the first thing that happens is things begin to look different. Look is visual. So if your A is highest, then you are a visual learner. So you represent with the, internalize even visually about the thing. You interact at a visual level. So B is things begin to sound different. So that means you prefer auditory senses to work more in your listening. And then things begin to feel. So wherever feeling comes, that means you connect with the world on emotion. So if I may look at Dr. Deepika's scores. So Deepika, A is 8, okay, B is 1, and then C is 6. Am I right? So in your case, you can see that you are also a visual learner. And then you interact on emotions also. That is C6 for you. Okay. Dr. Amrit, in your case, your primary way of interacting with the world is auditory. If somebody just says something and you are able to hear with attention, you will be able to understand the people. So why do you think I gave you this activity? Why did I talk about this activity? So Dr.
To know
Santosh, in your
ourselves.
case, your A and C are very high. So that means visual and feelings are high. Yeah. So why do you think I gave you this activity, this questionnaire?
To know the learning style of each one of us.
One is to understand your learning style. And you could see you all have a different learning style. So as a trainer, as a facilitator, you need to remember that you will have a mix of groups. People will have different learning styles. So your program or your session should have a mix of everything. For example, if I am a visual learner and you just come and talk and go, I will not learn as much if you had a presentation or something for me to look at and then learn. So simultaneously, if you were talking and you were showing something, I will be able to learn better, other than if you just go and talk and don't show me anything. For example, if I give you set of instructions, so do you have a pen with you or a copy with you?
Yes.
Take out just small sheet of paper.
Yes, ma'am.
It could be a waste paper. Okay. So I'm going to give you a set of instructions and you need to, follow those instructions. Okay. So fold the paper in two halves. Take one corner of the paper and take it to the extreme opposite corner and fold the paper in the same manner. Again, fold the paper from the 1/3 portion towards inside of the paper.
It shows I'm a visual learner. I'm stuck.
Take the other corner of the paper and now turn it outside. Fold both the corners together and bring them closer. Is it making sense?
Yeah.
So what I'm doing, I'm just giving you a set of instructions.
Yes.
Dr. Amrit has done it because she could understand my instructions. But I'm sure most of us were feeling frustrated. Now, if I take a piece of paper and I say, take a piece of paper, hold it. Take one corner of the paper and fold it to the opposite corner. Take the other side of the corner and turn it inside. Take the other corner and turn it further inside. Is it making more sense?
Yes.
Yes, because
Yes.
Yes.
the
Yes.
during the instruction also, which end to which end was not mentioned clearly.
Exactly. So
Although Dr. Indu said farthest corner, so I was thinking farthest is the one which Dr. Indu actually did. But then I got confused and I did the rectangle type of a thing.
exactly.
I made a boat out of it.
Oh, you assume that probably I'm going to make a boat.
Yes, so I assumed. So I visualized.
And many of you may have thought that probably I'm going to make that flying, aeroplane that we used to make and play when we were kids and we used to throw at each other.
Everybody made a different thing, actually.
Exactly. So, you have a mix of audience. You know that the concept is complex. So, involve as many senses as possible. So, with adults, we have to remember that they have different learning styles. So, your session should make sure that those learning styles are integrated in your session. So, that is called, let me show you the screen and get back to the. Okay. So people have different learning style. So it's very important to remember that we have to bring in all learning styles when you are facilitating a program. The third point that I want to make here is they unlearn slowly. So which is your dominant hand? Which is your dominant hand? right? For all of you? Okay. So write your name with your dominant hand only. Okay. Santoshi, yours is left.
Yes, ma'am.
Okay. So with your dominant hand, write your name in your notebook. Now, with the non-dominant hand, write your name in your notebook. Was it easy?
No.
No.
Was it easy? No. No. Because we are so much used to using our right hand. And if I ask you to use your left hand, you will take time to learn something new and also unlearn. So adults take time to unlearn because they are used to a particular way of doing it. So many of us still prefer, hard copy of the book instead of e-book. Right.
Yes.
Right.
Absolutely.
Because we are so much used to holding a physical, book in our hand and reading. And then also, we all know that we are talking about so many pedagogies, but most of us would depend on PPT as a way of teaching, as a way of facilitating the program. So we know it's slowly getting outdated now. People do not use or do not recommend using PPT. I think I mentioned to you in the last session that I did that program with Gail Carnegie, and the trainer who was facilitating the program, 3 full days we were with him for almost like 8 to 6 p.m. Almost like 8 to 6 p.m. Not even a single slide. Can you believe this? Not even a single slide. He had his set of slides. He would refer them to make sure that the session flows in a very structured manner. But he did not show even a single slide to us because he knew if I have to engage my audience, I have to make them do, I have to make them participate, I have to make them do activity. So adults unlearn slowly. We are all in habit of using PPT. So if somebody says, don't use PPT, and just do the program, how many of you will be able to do that confidently? Write yes in the chat box. No, we will not be able to. I agree with you completely. So we adults take time to unlearn, and that means we really need to have patience to work with them. Another very typical thing about adults is they like to share their experience. If you want to really engage them, okay, Dr. Amrit says, yes, as I do not know how to make one. Yes, so that goes in your advantage. That because you don't know how to make PPT, you think, I mean, I can deliver without PPT also. Dr. Sneha says maybe less slide, but not without it. Okay, Dr. Deepika says I'm not right, so not sure. Yes, I don't use. Dr. Manisha says I don't use PPT. Now, suppose if you don't use PPT and if I ask you to make PPT and run the show with the PPT, you will find it challenging.
Yes, it is very challenging, ma'am. When I have to present a PPT, it is very challenging for me.
Absolutely. So another feature of adult learning is that they like to share their experience. Because if you are able to, connect their experience with your flow of session, you will definitely see that they will get engaged. So this thing you have to keep in mind. And then they take time to change. I mean, they will never apply everything in the first go because they will take time to, first of all, understand, accept, and then, even if they try to change, even if they want to change, they will still, be contemplating or still be skeptical about how will this work or not, or other things. So they take time to change. So if I put everything together, adult, it's an acronym actually that I have used. So awareness versus consciousness. They have difference in learning style. They take time to unlearn. and then they like to share their experience, and then they take time to change. So this is an acronym for adult is an acronym for this. So these are the features of adult learning. So if you keep this in mind, that whenever you are facilitating a program, you have to integrate these things in your interaction. So what exactly, and we are going to talk about it in a while. There's another concept that I want to introduce, and that concept is called concept of HUMDA, HUMDA. So it's an acronym again. So adults will first of all hear what you say. So they just listen to you. So you will see a lot of time when you start your session, you will not see any, expression on their face, or you will not see them nodding with what you are saying. They will just be kindly listening you and kind of listening you and not giving you any feedback that yes, I'm understanding or I'm agreeing with you. So H stands for hearing. They will just listen to you. Then they'll try to understand what you are saying. They've yet not started agreeing with you, but they'll try to understand what exactly you are, saying. So the Humda, you sit, understand. And then M is whatever you have shared with them, even after this session, they will meditate on it. They will think about it. They will kind of, before they accept what you have said, they will actually still be contemplating. Do I agree with this? Do you think it will work? So they will actually, they will be contemplating, they'll be thinking, so they'll take time. And then if they agree with what you have said, if they think what you are saying will make sense, that is where they will digest and they will, okay, kind of start getting this realization, yeah, it's making sense. It's like, somebody's bulb gets on when they agree with you. And then finally, that is where they will accept what you have said and they will apply. So whenever you are, facilitating a session, don't expect people to immediately agree with you. We have to understand that this is how processing happens. People will not immediately agree with you. Usually, initially, they'll be just listening to you. They'll be kind of simultaneously, maybe, evaluate what you are saying, whether they agree or not, whether they, and it's a simultaneous process. Then once there is some agreement, there is some acceptance of what we have said, that's where they will start realizing, okay, this can be tried or we can experiment. So adults normally will not take what you say. So it's not like school children, when you teach them a way of solving a sum, if they go home and if they talk to their mother and the mother teaches another way of solving the same sum, they fight and argue with their parents and they say, no, my mama, you are wrong. My teacher has taught me in this way and your way of teaching is wrong. Because for them, whatever teacher has said is the final word. But with adults, that is not the thing. So we have to keep in mind that there are different aspects of adult learning, and if you're able to keep that in mind, you can facilitate a good program. So some of the principles that you have to keep in mind when you're facilitating a program: adults learn when they are ready to learn. So you will never get a ready-made audience. For example, even for this session, although most of you have voluntarily registered for it, you are keen to learn, but still you will not just simply quietly accept what I say. There will be time when you are not accepting or agreeing with my point of view. So adults would learn only if they are ready to learn. So creating that mindset or creating that readiness is also the responsibility of the facilitator somewhere. Then adults need to understand why should they learn. So when you facilitate a program, remember that if you want them to become engaged, you have to focus on why. Why should you learn this? So if you tell about this is good for patients, this is good for the organization, we will have more patients, your staff would say, why the hell should I learn this? Or why the hell should I change my way of doing this? So the acronym that says, what is in it for me? You can keep this, you can write this. W is in it for me. WIIIFM. What is in it for me? WIIIFM. 3 times I. And then adults learn when their experience and knowledge is acknowledged. So during the facilitation, we have to remember that we have to not only make them speak, but when they speak, we have to acknowledge and appreciate their knowledge. And then adults rapidly learn when the results are satisfying. So therefore, when you are trying to bring in change or bring in some improvement, you have to really make sure that you create activities and tasks where people are able to see the result of their performance, where they can see a change happening across. So if they're able to see the results and the positive side, they are more likely to engage. And then adults learn by doing. So therefore, just having a seminar or webinar is very boring. You will lose your audience. They will not be learning much. And you will not believe, a lot of time when I see feedback, it very clearly sometimes shows that, okay, I have not been able to engage this particular participant of mine. So therefore they are not, they are not learning much. So they are not satisfied. So you have to really engage them and then make them do, some activity, especially if it's a physical program that you are doing. If you make them do and learn, they will be quick to learn. And then adults learn when they trust the trainer or the facilitator. So building trust is an equally important part of action as a facilitator. So learning from this, I think we need to understand that adults should understand the purpose of the program. So make sure that you talk about the purpose, why we are doing it. Because if you are able to help them understand the purpose, they are more likely to be aligned with your program. Then create a need to learn. And as I said, the need not just for others, of course, that's one part, but for them also. By learning this, you will be able to avoid violence. By learning this, you will be able to avoid or contain mob attack. So I normally tell people that when you learn to communicate effectively with patients and their family members, you will be able to avoid, kind of aggressive reactions from the patient party, or the risk of litigation would go down. So now they will accept what you are saying or agree with you more. Then engaging the audience is important to make them participant. So you have to really integrate activities and ways when you are able to engage the audience. And the climate should be friendly and informal to encourage participation. So with the adult audience, if you try to play the role of a teacher or a trainer and you say, I know more and you don't know, and I'm the one who's going to deliver you, the information and or the new skill, you are not going to be accepted. So you will have to somewhere kind of give them a feeling, I am one of you. I am one of you. You are expert in your this thing. I know little bit more. I try to see how I can impart the same knowledge as you. So you create more friendly environment where you allow everybody to speak, you allow others to give their opinion and respect their opinion. And then relating and acknowledging their experience makes them. I'm repeatedly saying this because that's the way you can actually make your audience participate. So it's very important to relate and acknowledge their experience, and that makes them interested. And then another important point, the trainer needs to be thorough with this subject knowledge. And the training pedagogy is to engage all kind of knowledge. So we have seen a lot of people, excellent with knowledge, but when it comes to imparting that knowledge, they fail. Because they don't know how to engage their audience and also impart that knowledge by simplifying or making it interesting. So that is a little bit about the adult audience that we talked about. Now coming to the guidelines of how do you facilitate an effective program. As we discussed last time also, there are a couple of things that you have to make sure when you start a session. For example, the physical setup and sitting arrangement. You have to make sure, usually with adults, it's good to make them sit around a table. So maybe 3, 4, or 5 of them can be sitting around the table. So you could have multiple tables where people in set of 4 or 5 sit together. If you will go for a webinar or seminar kind of a setting, people sitting in rows, again, participation will be less. Things like whiteboard, projector, audio, video. We have talked about it with just one slide that I want to kind of ensure that you remember. Name tags, wall clock, water facility, other resources like whatever activities you want to do, flip charts, CPAs, handouts, and then props, etc. are already there. You have to make sure that you have all these things available. So before you do the delivery, you have to make preparation. So one rule that you have to keep in mind is rule of 10:1 in preparation. Can somebody explain me what exactly is preparation rule 10:1? When you are
It
preparing,
takes 10 times the time to prepare for that 1 minute of
Mhm,
presentation.
It
10
is
minutes to
instructive.
prepare and
It
1
is
minute to deliver.
mhm, mhm. Thank you so much. I think you have really given the exact answer. Any other understanding of this? Any other? Although Dr. Sneha has actually given the right answer. So for any session, it's almost like preparing, devoting 10 times the time you need to devote to prepare. So, but that does not mean for a 5 minutes presentation, if you spend just 50 minutes, you will be able to make an excellent presentation. It doesn't actually apply to small duration sessions, because even for a 5 or 10 minutes presentation, for example, when you make presentation in conferences, are you able to prepare in 50 minutes? No, it requires a lot of time. But usually for example, for an hour's presentation, for a session of say 1 hour, you need to devote almost like 10 hours to make it. So 10:1 exactly is the 10 times time that you need to spend in preparing for your session. 10 times. And then again, this is when you are thorough with your content. It could be even more than that. Then know far more than you will ever use. We all know sometimes audience will ask you questions. Maybe they have a question, but if you are able to answer that question, audience will start trusting you. If they ask a question and you do not know, there's a possibility that they'll have a feeling, oh, he or she is not very well prepared. So you really need to be prepared far more than you are ever going to do. So your knowledge base, subject knowledge base has to be very, very strong. Please remember, at least 3 times more than what you're expecting, in terms of being asked. Also, when you are integrating activities in this session, please remember that all activities will take longer than what you think. If you think this role play will take 15 minutes, trust me, it will take you at least 20 to 25 minutes. If you are thinking an activity will take you 5 minutes, it's definitely going to take you far more time. So that's how the program gets delayed. The session gets, delayed, and not delayed in the sense it takes longer than what you anticipated. Because when the audience starts, participating, they start giving their opinion. You can see that they'll have more questions or discussions in them. And then plan for both smaller and larger than anticipated. What exactly we mean by that? What exactly we mean by plan for a smaller or larger group than you anticipated?
in the
So
form of
all
documentation, notes that you're supposed to give, handouts.
Dr. Santoshi, can you have your camera on? I'm not able to see you.
Yeah, ma'am.
Yeah. So what exactly we mean by this?
Like in the form of documentation.
No, my question is, yes, like Dr. Gamrit has mentioned, people may be absent. What I'm trying to say, you thought, okay, there'll be around 50 people in the to be around 20, 25 people, and you enter the hall and there are almost like 100 people. So Mamta, has that ever happened when you do your trainings with your nurses?
What, ma'am?
Like you prepare for say around 15, 20 people, but there are only 2 or 3 people in the audience.
Yeah, I worked in NICU. I only hardly worked for 8 months, but it never happened like that with me.
It never happened because yours is a more, scheduled kind of a training program where people who are asked to come and attend the training, they will come. But when you're doing an open program, for example, you are invited for some seminar or some short training program. Anybody else who would like to share their experience on this? Dr. Kundan?
Yeah, I have. This happened many times when the audience has turned, less the number of audience have turned. But for me, sometimes, if I am training for junior doctor, sometimes the consultant joined the program. Different audience also join. So you have designed the pedagogy or all the presentation for junior doctors. All of a sudden, consultant join, and then you have to alter your narrative.
Absolutely, absolutely. This often happens that there will be, people who you were not expecting and will become part and parcel of the audience. Yes, Dr. Santoshi, I think you wish to say something. Go ahead, please.
Yeah, it has happened to me many times, especially during programs where the participants were supposed to attend, but they didn't report because of some ad hoc work in their company. So sometimes I have traveled from Delhi to Bangalore and only one candidate attended the program. So for me, it was mentally it was a shock, and I was not at all interested to conduct that session because, and that participant also sometime was on call. So it was like, I wanted to just fulfill my time. And I have to, because I was there and I have to do the program. So I did the program for one candidate. And see, the candidate, maybe it's 1 or 2 or 10. If the delivery of content, we have to deliver that content, and that content will take that much of stipulated time which we have planned, irrespective of the number of audiences. But that has completely demotivated me to conduct that program because I traveled so long and there was only one candidate.
I completely
it was not a fruitful program. Yeah.
Lot of time when you go for making a presentation in a conference, when you are invited to speak in a conference, I'm sure many of you may have experienced that you have gone with lot of preparation and the audience is missing. I have seen it a lot of time. And especially on a topic related to communication, you will see number of times they will not be people who are very interested to learn. I have seen this a lot of times. So as you said, you get upset and then you feel demotivated and you don't feel like doing it. And then it becomes very disturbing. So how do you really mentally prepare yourself? So if you already know that in conferences, this is another possibility that you will not have a lot of people to attend. You spend a lot of your time preparing for it. You traveled, you have gone there and there is no audience. Or it could be the opposite also, that you have gone with the preparation for a set of small, audience, and there's a huge crowd. Again, that can be very overwhelming. That can be very upsetting. But then we have to mentally get prepared for it, and this can happen. So I can see a couple of messages in the chat box. Dr. Sneha says, have experienced where I have to shift the language because many junior nurses who are not very fluent in English. Yes, very true. This will happen very often that you have prepared your session in English because we normally expect people to know that language, but when you go and see your audience, they could be very different. I can see another answer in this chat box. Dr. Deepika has written, maybe an activity is planned keeping the attendees. So we need to really plan. Yes, this can happen. You plan that, okay, we'll do this activity, but the audience is missing. Or the audience size is too large and you cannot engage everyone. So you really have to be very versatile because that means you really need to have a backup plan that you're going to use in that situation, especially when our session is scheduled during the end of the day. Absolutely. So sometimes people are not interested, people are in hurry to go. If it is not compulsory for them to attend, people may, leave the session and go, and especially if it's a senior audience, again, they will not, take your session very seriously. They might just walk out of the. Dr. Amrit has written, people may be absent. So what I'm trying to say here, it's very important to be mentally ready for this kind of thing, because otherwise your facilitation can go completely haywire. You will get upset, you will get And also sometimes we take this as a personal insult. We also start questioning our ability. We start questioning our purpose. We start questioning, am I not a good speaker? Is my presentation not the same? Is my topic not very interesting that people are not willing to attend? So, but we don't have to really let that affect our performance. So that's the thing that we have to keep in mind. So please, yes, please go ahead.
Ma'am, I think in hospital settings and as doctors, we are little bit used to, because when CMEs happen, a lot of people join. But then if something comes up, people leave in between. And then if the CME or such type of talks happen at the end of the day, people want to wind up the day and leave. So the attendance as expected can be low. And no, besides being a doctor, I work for a cause, child sexual abuse. For that training, I went to Bangalore. And as somebody shared that there was only one audience. So I was told that there will be 20 participants, but there were only 3 people. I traveled and I had to come back on the same day. But then you keep it interesting so that you make it that interesting that people who missed it, they regret that why they missed it.
So that means you could consciously think in this manner and you could still deliver. And that's what I'm saying, but not everybody is that experienced, especially when you are starting your training career.
And it also comes in time, and it is not that at that point of time I was conscious and I was able to handle the situation. Even the people who are in trainings for a long period of time sometimes get affected and they might not deliver the situation. So no, that's why it's important to handle.
That is the purpose of bringing this point here, that you have to be mentally ready for it. So Dr. Neha has raised her hand and also she has commented. So do you want to read your comment yourself? If you
Actually, comment is slightly different, that I've conducted the training session for consultant as well as juniors, but I had to conduct more sessions. I conducted, but one feeling I wanted to share, because when consultants don't join, then you feel they are just not bothered. They are not bothered. And maybe some people are taking it that, oh, this is useless, but why should I go? That feeling came, but I still conducted 2 or 3 sessions, so that I mean, then medical superintendent was after the life of consultant, do please come. So I had to conduct I think 3 sessions to complete I mean, make the awareness and all the consultant. But that feeling came to me, okay, I knew that people were not that busy. I knew that.
Yeah, but people do not
that
value
at that time. Even then, people had not come. So
yeah, absolutely. So thank you for bringing that up, and that's what was the point, that you have to be mentally ready for it and not get affected with this kind of situation. Sneha has written a couple of comments. We also need to address the change in the morale of the rest of the audience. Yes, if you have it, and plus, you get your energy from your audience, and your audience gets energy from you. If you can keep your mood upbeat and deliver the session in a cheerful manner, that also shows your resilience, your expertise, your confidence in yourself. And that's what is real acid test of your performance, I can say so. And then they too get demotivated when less people turn up. Yes, but if you're still able to deliver your session in an effective manner, it goes a long way in helping them know that you had done a lot of preparation. They might even go and talk about it, that the trainer had done great preparation for this session, but unfortunately, we missed to do it. So a lot of time when people don't join on time or come on time, I narrate, a couple of stories to help them know that why it is important to, join on time or participate. So I'm sure you must have heard of that story between Akbar and Birbal. Have you heard of that? That story where Akbar says that I want to check the honesty of my people. I want to check the honesty of my people. Have you heard of that story? No. So let me quickly bring it here. That will help you understand how you need to really sometimes, help communicate your message in a lighter way, but then it does make an impact. So one day Akbar tells to Birbal that I want to check how honest are my people. and for who listened to me previously. So Birbal was always a very, quick to give solution or ideas. He said, that's very easy. We can do it. There's no problem. So he said, okay, so what do you suggest? So he says, there's a pond outside the, state. So let's get that pond emptied and make an announcement in the state that you have to put 1 lota of milk in that pond. So Raja Akbar asked his employees to completely remove every drop of water from that pond. The pond was completely emptied, and then there was an announcement in the town. Everybody was told that each one of you have to put 1 lota of milk in that pond. So next day, when Akbar and Birbal went to see the pond, they were hoping that the whole pond will be full of milk because that was the announcement. To their surprise, it was only and only water. And everybody thought, others are going to put milk. So what if I add water? Nobody will come to know whether I added water or milk. That's diffusion of responsibility. So when everybody thinks, oh, the session is at 8 o'clock, it's okay even if I join at 5 minutes after you. It's okay, others will be there and then they will start. But each member has a role because the program, we feel like starting the program when everybody is there. So that's how I make them understand your participation or your joining on time is important. Similarly, when it comes to, understanding the value of time, when we say we have lost 5 minutes, I say we haven't lost 5 minutes. If you are 20 of us, we have lost 100 minutes. 5 minutes each means we have lost. So that's how you can use different ways to emphasize the value of time, value of participation, value of, taking responsibility. And especially with the adult audience, you need to be really good at using these different ways to emphasize the importance of various aspects of participation. So the idea is when you're preparing, be mentally prepared for both smaller and larger than the group size that you're expecting because it should not affect your performance. When you are, going to deliver the program, establish some ground rules. For example, right in the beginning of the session, clearly tell what do you expect. So, for example, if you remember, when we started the session, there were some ground rules that we discussed. That please keep your video on, keep your device on mute mode. Please do not attend to phone call. If you really need to attend, keep it very. So these were the ground rules. So it's more like that I have informed you. A lot of time people will assume that because this has not been told, so that is not the rule. So it's better to orient the group to the ground rule so that they know that this has been clearly spelled out by the facilitator and we have to respect them. And then also we have to respect to the time frame and the purpose of the program. Sometimes some people take lead in talking, they don't let others talk. So if you remember right in the beginning, I said, see, all of us have experience and you all are very seasoned practitioners, but we need to remember that we have a mix of people and everybody should get a chance to speak. So we should give opportunity to others to answer. So when you establish these ground rules, they will be more, they will be more mindful of their conduct in the training program. Now coming to the training format, how do you really format your training? What exactly we mean by this? Can anybody, share their thought? What exactly I want to cover in training format? Mamta, any idea what I'm talking about?
Yes, ma'am. Training format. Starting, we will structure the curriculum.
Okay.
After structuring the curriculum, we will see who are the target groups or the audience of this program. After concluding all the training participants, we will give them the link or the link. Then the first session, orientation session in the training program.
Hold on.
Orientation.
So, sorry, I'm interrupting you, Mamta. Sorry. So what exactly I wanted to say in this session, how would you format your content? How would you place your content? I'm trying to ask that part. So I'll give you an example. So one of the training format is how would you sequence your content when I say simple to complex? Simple to complex. So what exactly I mean when I say simple to complex? Mamta, either you can answer or anybody else also can raise
No,
their
no.
hand.
In this program, yes, it is going from general to specific, ma'am.
Okay, that's also a good explanation. That's another good training format you're talking about. So when you have a topic to talk about, you first talk of general thing and then you bring them to a specific topic. So that means that's how you have introduced your topic from general to specific. That's one good format. Then simple to complex. What exactly we mean by simple to complex? Dr. Priya, any idea about what I'm saying? I'm talking about the training format. So, for example, you want to teach somebody surgery. Yes, Dr. Deepika, right? Known to unknown. Again, a good format. So that's also one of the training formats we use. So I'm talking about simple to complex. For example, if you are going to train your students in a particular surgical procedure, so what will you teach them first before you actually allow them or before you actually tell them about the procedure or you talk? A lot of time we teach them first to learn how to suture, how to clean the wound, how to.
Dressing also.
So that means you are starting from a simple thing which is easy to learn and then take their learning to a more complex thing. So whenever you, so we have 10 topics to cover in 10 sessions. I could have taken the last 5 sessions and started with them in the beginning. I would be struggling more because I have not laid the foundation. And once you have laid the foundation, then it is easy to talk about the complex topic. So, for example, if I want to talk about disclosure of medical error or how do you handle aggressive patient party, but if I have not talked to you about what are the different ways we communicate, verbal, non-verbal, and body language and other things, you will find it difficult to really understand why are we emphasizing on the tone of voice? Why are we emphasizing on the body language? So it's a good idea to start from simple to complex. Then somebody said known to unknown. Yes. So if you let people, learn from a known concept and then take them to an unknown concept, they will learn better. Any example of known to unknown? Any example of known to unknown? So we talk about washing hands and 7 steps of washing hands. So if I want to really teach people to learn the 7 steps of washing hands, I'll ask them, okay, how do we wash hands? Can you demonstrate me? So they know it. They'll pick up soap, they'll apply on the hands, they'll clean, and whatever they know, whatever steps they know, they will follow in front of me. There will be certain steps that they will miss. And now, if I can tell them that these 4 steps were absolutely right, these 3 steps we need to integrate. So what you have done, you have first asked them what do you know, and then you also add what they do not know. That can be another format, known to unknown. I can see one answer by Dr. Sneha, temporal to logical sequence. Sneha, I want you to elaborate.
So if I'm training about a certain consultation on a certain thing, so maybe sometimes we can start by what we would do step by step in the consultation. So certain topics can be covered like that.
So again, you're talking about the format that you have actually given them a time frame that this is how we are going to cover.
Yeah, for example, if we are doing PALS or basic life support, first we'll give some general principles and why, but then we will go step by step that if this happens, then this, then this, then this, like that.
So more like a flow chart you're talking.
Yeah.
Options, and then under each what will be the option. That's also
yeah.
Then there's another format which is normally mentioned, that is concrete to abstract. Concrete to abstract. So what exactly we mean by concrete to abstract? Can anybody?
So we will first address the knowledge and skills and
Okay.
then move on to attitudes and communication, more softer
Okay.
philosophy.
Again, that it's more like from gender to specific or from known to unknown. It's something like this. So when I say, is somebody answering? Is somebody trying to answer? Okay. So when we say concrete to abstract, let me give you an example. We talk about SOPs. How many of you are comfortable writing SOPs for your work area? You have heard the word SOP? Everybody knows? We all know because now we are
Yes.
about quality so much, we all know. So we normally talk about SOPs, and how many of you are comfortable writing SOPs?
Yeah, I can write.
Because you are into assessment, so naturally you will be reading a lot of SOPs, so you have an idea. But most of us do not have an idea about SOP. Now, suppose if you have to talk to your audience and tell them you have to write SOPs for your department, I'm sure your nurses and your residents will say, we don't know, this is something we can't do, please get it written by somebody. That's what most of the people are doing, they're getting it written by
Yes.
others.
Yeah.
Now, okay, I want to introduce you to the topic of, writing an SOP. How do you go about writing an SOP? And then I ask you, how many of you know how to make a cup of tea? I'm sure all of us know. Okay. And then I ask you the next question. Okay, tell me, how do you make a cup of tea? I'm sure one of you will say, okay, take a saucepan and add, if I'm making 1 cup of tea, then I have to take 3/4 of a cup of water, put it on the heater or the stove, and then put it on, let it boil, and then add sugar, and then add the tea leaves, and then you need to add, milk once it starts boiling, and then wait for a couple of seconds, and then you strain it. Is that right? Is that right? Is that right? So what you have shared with me is SOP of making a cup of tea. Can you write this down when you ask your audience? I'm sure they'll say yes, we can. Who will do this? How long will this you do? What all you require? What is the quantity of water you take? What is the quantity of tea you can sugar? They can. So, okay, this is the SOP of making a cup of tea. So similarly, SOP of dressing a wound, SOP of attending a emergency, SOP of CPR, whatever there is. So what I'm trying to say, if you pick up something concrete and then you connect them with something abstract, SOP is abstract for most of us because we are not used to them. But if you give them a concrete example, which they know, which they are familiar with, which they can do comfortably, and then if you take them from here to that point, it will be easy. So I'm talking about different formats. So something might work somewhere, something other might work in another. But you need to be, first of all, versatile in using different formats. With certain audience, you will have to start with, helping them know what they don't know. So a lot of time when you give a pre-training assessment form, your audience will settle down when they get to realize, okay, I don't know this. Even something as simple as, okay, what is the pre-diabetic range of blood sugar? Knowing it exactly. So it will ground them. So in different situations, with different audience, we really need to be changing your format. Different formats also bring curiosity, interest. And that's very important. If your way of delivery is same every time, trust me, people will know this is what you're going to do. Every time come up with a new format. And one of the regular formats that you have to remember if you want them to learn something, especially we are talking about skill development or learning some new thing, skill, it's always tell them, show them, and let them. Tell them, then show them, and then let them. So if you want somebody to learn suturing, so you have to first maybe tell them that, okay, this is what we do. And then you have to suture and show them, this is how we suture. And then you say, okay, now we do. So similarly, when we ask people to handle situations, which we'll be doing very often from the next session onwards, because in almost every session we'll have some role plays where we'll be taking situations. So there, maybe in some situations, I will ask you to, show it. How do you handle? So maybe I ask somebody to play the role of a doctor, the other one the patient, and the third one the patient attendant. And I'll ask you to show it how you do it. Or in some situation, maybe I'll show you how to do it, and then I'll ask you to comment on it. So that means you are using different formats in the different sessions. So the whole idea is, if you want them to learn, just verbally telling them will not do. So a lot of action has to be integrated with what you are. So that is also one of the formats that we use in this thing. So somebody had written about the opening the dialogue, then message, and then body. Dr. Deepika has written introduction, body, and conclusion. So that is, you're talking about the presentation structure, and you're very right. So these are the training formats that we have discussed. You can sequence from simple to complex. It could be from concrete to abstract. It could be from known to unknown, where you take people from the known area to the unknown, new learning. The other training format that we have talked, where you follow the steps, where you tell them, you show them, and let them do. You can even change the order, because we have to cover all three. So depending upon your audience, you can change the order, the order of the format. So basic presentation structure, as written by Deepika also, there's an opening, then there is something that you want to deliver. You have to provide some evidence to what you are saying, and then closing. These are the four major, presentation parts that we normally see. But we need to actually prepare each segment very carefully. So please make sure that all four, phases are prepared and, readied well in advance, and you have a lot of clarity. So for example, when I say, opening the session, you should know how you are going to, open your session. And like we all say that, well, given this half done, you all say, if you're able to, engage your audience right in the beginning, you have already, done half the job. So make a very impressive opening. So what are the different opening ways that you use with your audience, if I may ask you?
Asking questions.
Okay, asking questions, that's a good way. So,
giving them very startling facts.
Yeah, some starting facts. That also is a good way. What
Story
twist.
Yes, storytelling. Yeah, storytelling. Giving situations. Yes, giving situations and asking them to brainstorm. How will you deal with it? What do you think the person did right? What do you think the person did wrong? If you were in that position or in that role, what would have been done? So again, you are kind of engaged them. Okay, somebody has written in the chat box. Let me read what it is. Give me 1 second. Okay. Okay. Cracking joke. Okay. What is the risk, Dr. Kundan, if you use cracking joke right in the beginning?
Yes, there is a risk of the audience not taking this presenter seriously. But there is a other side, that it may be well connected to the audience. The audience, if it's bored before the previous training sessions, it may come out lively if they really like the joke. There are both sides of the coin, actually.
Absolutely. So that means if you are very seasoned and you know how to handle, you can be excellent at doing it. But if you are naive and if you crack a joke and if it doesn't go in good taste with the audience, it can misfire. So I would suggest that this is something you should do if you are really, if you have a good control on the overall session, and your audience knows you very well, and they know that you have a habit of, making the session light by, bringing some jokes and something. But we have to be very careful, and that it can offend somebody. Somebody has written it can. So examples from recent news. Yes, again, you say, have you heard of this? I recently read this news. How many of you have, and what is your feeling about it? So again, you're asking some thought-provoking question. The whole idea is, okay, Dr. Deepika says, show interesting picture or videos. Yes, when you show something interesting, they become suddenly interested in knowing what it is. And there are many good ways of starting a session. You could start with a video. You could start with a quiz. You could start with a with the storytelling, like you said, you could start with the storytelling. You could throw a puzzle at them. You could show them a picture, or you could make a very, startling statement. So it makes them think and engage with you. Or you may, bring some interesting quote by a well-known person. Okay, person so and so says that this is what is the reality. We don't listen to understand, we listen to answer. This is something that's said by Stephen Covey, and then we explain it. So there are different ways. The whole idea is that if you are able to engage the audience right in the beginning, most of the job is done. Okay, Dr. Kundan says starting with a 1 minute of meditation. Again, how many of you agree with this? Or do you have any thoughts about what Dr. Kundan says? I'm not saying agree or disagree. So what is your thought about it?
Actually, meditation is something, I mean, most of the people will not be used to it, and their mind will be wavering somewhere, and there may not be, and they might be doing something, picking their phone. I mean, they might be talking also in between. Not everybody might be doing this meditation.
Wonderful. Dr. Amrit says they may be taken in religious reflection. Yes. Especially if you are talking with some cult, they'll say, okay, now this person is going to now say, follow this guru and follow this person, or they want to do. So again, it may not go in a very good pace with a lot of people.
They can use, we can use visualization, but it is not to be used in the starting. It can be used in between to make them understand or reflect the situation.
Wonderful. So creative visualization is one of the pedagogies that we use. But again, when you are doing that, you have to be careful in picking the situation that you're going to narrate. I remember in one of my initial sessions, and after that, I really changed one point. I used to just give them the list of topics that you need to present. And then one of them presented on creative visualization, and she narrated, or she kind of gave them a narration. She said that imagine that you have gone with your husband or with a family member to a very beautiful destination, lot of greenery, very beautiful place. It's a wonderful, state where you have gone. And then suddenly, your husband or your family member, somebody has some health issues. And now you need to take that person to hospital. So that was something I had not anticipated, that somebody will take this as a situation for creative visualization. After that, I took the decision that no presenter will present without showing their presentation to you, because this can miss. Yes, Dr. Kundan, you wish to say.
By meditation, I mean not chanting any om or something, just sitting quietly for 1 minute with eyes closed. I have seen this in some of the workshops, and it, I think, works very well, connects with the audience most of the time. They don't feel offended. In fact, if there are many sessions previously, they feel a little bit refreshing. But yes, again,
I was about to say this. If you have been able to establish rapport with your audience, they are more likely to enjoy what you are, because that is very different from the theoretical topic that everybody is talking. So they will feel okay. If you make them do some physical exercise, get up, sit down, so they'll enjoy that. But if the audience is senior, please remember. So that's also very important thing we have to keep in mind. If the audience is junior to me, they are more likely to be happy with what I do. But if they're very senior, they are actually still skeptical about you being a trainer. So there they are going to take everything, they're going to judge you for everything. So you have to play safe in this. Okay. So Dr. Santoshi has mentioned having brief introduction of all the members and sharing their experiences to training, if any, and acknowledging. That's a wonderful way. And then that's how, especially if you are entering into a long-term kind of a program, it's always good to have introduction of all the participants. But if it is just an hour or 2 hours of training, a lot of time can go waste. Actually, it happened once with me. We had around 22 participants. There were a couple of participants from from the previous batch. And then we had a huge batch. And I did not say that please take only 30 seconds to 1 minute to introduce yourself. Can you believe we lost almost 45 minutes in the introduction of the participants? I'm sharing my failures with you to help you understand that this way. And in my notes, I have written, wherever I write my detailed program notes, I've written that in case if the audience is large, be very specific in saying that please restrict your introduction to only 30 seconds. And then we have a chance to know each other more because we are going to be interacting in the further sessions. Or you can also say that, okay, I'll request only 5 of you to introduce now, and then next 5 will be introduced in the next session. So you'll have to really, or maybe if it's too large a group, then you'll have to do away with the introduction. So I think it's an interesting, discussion that we are having in this new learning pre-assessment questionnaire. Yes, and a lot of time, even that helps in, first of all, grounding your audience and also knowing your audience. And then some quotes or anecdotes. Yes, that's a very good way of starting your session. So the whole idea is that we should know what are the different ways of opening a session and what will work in a particular situation. So for example, like I said, you should clearly know what is going to be your opening dialogue, what activity you are going to use, and you should actually be thorough with it, because if you will look natural and confident in the initial 10 to 15 minutes, you're very likely to have audience who will align with you happily. Very soon they will become comfortable with you. So as I said, the opening can be with this startling statement. So if I say, do you know that almost like 250,000 patients die every year in US because of medical errors? Or if I say medical errors are the third commonest cause of errors in US. Or if I say in India, there are, almost like 52 million errors every year. Or if I make a statement and say medical errors in health, or it is safer to work in a nuclear industry and work in aviation industry than to work in a healthcare industry or to get admitted into a hospital. 1 is to 33,000 errors. Now you see, when you make such statements, immediately you will capture the attention of your audience, because this is something that they didn't know and you have suddenly brought it to their knowledge. So they want to know more about it. So they become curious and they become. Or when you start with some interesting quotes by some well-known, authors or celebrities, you get to, create a kind of a discussion around it. So when you say the single biggest problem in the communication is the illusion that it has taken place, and you will see a lot of times that you communicate, but the other person hasn't understood. So, and we assume that the person hasn't. Or some interesting picture, which kind of again captures the attention of your audience. So if I may ask you, how many faces can you see in this picture? Can you figure out the number of faces? How many faces can you see?
3.
2 faces.
3.
Honestly, I could see only 2.
2 faces only.
One young girl and one old lady. But Dr. Kundan says 3. So I want to know who is the third one that you're able to see?
At the hat, top of the hat.
Oh, facing the backside?
Yeah.
Okay. So now you see, you have another angle coming from your participant. So definitely that will help you engaging your audience, making them interested, getting their attention, because before they start interacting with you, their mind is wandering. They are probably in the previous session, or they are thinking about home, or they're thinking about to work. So you want to capture their attention and bring them to the session. So you really need to have something that brings their attention back to the classroom. You could even talk about any dramatic incident that happened recently, or you have witnessed yourself. So you will see them getting interested, or you share your experience, or you ask others to share their experience. So have you visited this place? Has anybody visited this place? So I'm sure 1 or 2 will say, yeah, I've been there. So what has been your learning, or what has been your? So again, you will see a lot of answers coming in. Or it could be some, some report, some reliable report when you share with, your audience. they become interested. So for example, if you share something like this, where you say that, see, 97 surgeries were performed wrong in the year 2021 in NHS. So people will become interested. Okay, that's a big number. So that's how they will start doing it. So this is about opening. Start thinking now, how can you, introduce your session differently. So from now onwards, when you are, going to deliver a session, even if it is 5 minutes, 10 minutes presentation, can I use some interesting way? So a lot of time when I talk about stress management with my audience, so what I do is I can, okay, take a piece of paper, and everybody will, kind of listen to you. Will take a piece of paper. So let me ask you, take a piece of paper. Can you all take a piece of paper? Yeah, it should be a waste paper. Sorry, please take care. It should be a waste paper. And then crumple it as tightly as you can. Yes, crumple it. Open it and try to bring it back to its original state. Can you do it? Are you able to bring it back? No. This is what stress does to your life. So friends, we are going to talk about stress management. So sometimes such ways of introducing a topic, your audience will immediately get connected. So start thinking now, how can you, introduce your topic in an interesting way? That's very important. The second part is the presentation now. Part 2 is presentation. So when you are planning your presentation, please remember this slide I had shown in the last session also. Content has limited value. A lot of time we have so much of content and we want to share all the content with the audience because you feel this is knowledge and this should go to your audience. But what happens? You deliver a lot of content. It's more like vomiting, which people will not be able to. So content actually has very limited value, but experience has long-lasting impact. So try to make sure that you integrate a lot of opportunities where they have experiential learning through different therapies. So presentation has to be where you are able to use different ways like role plays, some self-introspection activities, some discussion. That way you have to make your presentation very, very interesting. So one of the good ways, ask questions and respond with attention and praise. So every time you write in the chat box, I make sure that I read your reply in the chat box because I want to tell you that yes, I appreciate your, your interest and your attention and your effort to make an answer. So acknowledge the answers, appreciate the answers by recognizing your attempt. So to ensure participation, it's very important to again vary the ways you are going to handle. So for example, you can have an activity where you have everybody. So you must have seen that in certain pedagogies, I involve everyone. Then in certain pedagogies, you can take, okay, I want 5 of you to volunteer for this particular activity. Or I want half of you to go out. What I'm trying to say, if you vary the group size, where you either engage everybody in the activity, or maybe you take people on table and make them do something, or you have 3 people working together, where you have 2 people working together. So what you are trying to do, you are breaking the monotony. So in your presentation, in your session, make sure that you vary the group size often, so that that also brings some unpredictability, some curiosity in it. Normally, for a full day session, what I do, I would actually, normally people prefer sitting with the person with whom they are comfortable. It's usually their friend or their colleague or somebody with whom they're very comfortable. Even sometimes you will see doctors sitting on some tables and nurses sitting on another table, and they will not mingle, they will not talk, and they will not team up. So, but that's not the way you want to run this session. A lot of time, what I do, I would, have a set of questions and set of answers. So I know people are sitting with their partners and they are comfortable with them, but I want to break that pattern. So I will share list of questions to one side of the audience, and then the answer slips will be given to the second side of the audience. And then I say, okay, some of you have questions and some of you have answers. Get up from your seat and find out who has an answer to your question. So it will be a very simple question, something like, who is the Prime Minister of India? Okay, so or something which is easy to understand and easy to identify. So they mingle up, they try to find out who has the answer to my slate. They'll go asking, okay, this is my question, let me, and then you will say, okay, now make yourself, you pair with your partner and take your seats, and then start another activity. So why I'm trying to talk about this is to help you see you have to really break that monotony and that that pattern where we prefer sitting with people with whom we are comfortable. You could also vary your approach. So when I say varying approach, so like some of you said that we can do Socratic questioning where we ask questions and make people answer. You could even give activities where you make people brainstorm, where you give them a critical situation and you ask them, okay, what do you think the person did right? What do you think the person did wrong? If you were in that situation, what you have done? So you will get answers from them. You could also give them, a situation where, people need to do creative thinking. There is a situation. How would you handle? Can you find out a way to handle the situation? So again, you will see people will start thinking. People will start, kind of coming up with new ideas. So you could ask them to think. You could ask them to write in the chat box. You could ask them to unmute and speak so that you are engaging them in different ways. Role plays, we all know we use very often, and we will be using them. Case studies are a very good way to create discussion. Even the activities that you kind of use with your audience could be like, quiz, flip chart, reading, demonstrations, reports. The idea is the whole session has to be full of engagement. That's the message I want to communicate to you, that it's very important to engage people, to engage your audience. And then, of course, varying recognition, where maybe you can, just say, thank you so much for your answer, or you can applaud, or you can say, that was something I never thought. You've really brought in a new perspective to the discussion. So that way you are appreciating their participation and they feel good. Everybody feels good when they are appreciating. It's already 10 o'clock, 10:05, and there is some more content to be delivered. I want to ask you, do you want to continue with the discussion? We go on. What I'll do, there's actually still a lot of content. What I will do, I will just cover this part where we talk about the parts of presentation. We have talked about opening, and we are discussing about the presentation, and then we will talk about the role of evidence, why it is important to give evidence, and then how do you close the session. And after that, we'll close the session. The rest of it we will cover in the next session, and we'll talk about what makes a successful facilitator and also how do you handle disruptive audience, because that's a very important aspect of it. So very quickly, I'm going back to the presentation and covering the last couple of points that are left in the different parts of the presentation. So as I said, you have to really vary your approach. And again, don't always have a very predictable kind of an always come up with some new ideas. So like, for example, when I put you in breakout room, I'm sure some of you must be finding it very interesting that, okay, we are with a partner. Or when I sent you to waiting area, and then some of you I kept in the main area and then I gave an activity. So every time it brings some novelty to your session. So while facilitating the program, it's very important to ensure everyone's participation. So very often I keep saying, please keep your camera on, because I know when you put your camera off, you're likely to get disengaged. But in the physical session also, you have to make sure that people don't, suddenly become disengaged and they start doing something which can set a wrong example and also kind of create a disinterest kind of a situation. So keep an eye on the direction of the group in case if you can see that the people are getting disinterested or they're feeling exhausted. So maybe you can break the monotony by giving them a small energizer. Okay, get up from your seat. Let's do an activity. And then you give them some instructions and then they the activity and then you bring them back. A lot of time you will see there will be subgroups. People will, form. Some tables will completely get disengaged. So again, you have to handle your subgroups very carefully. We are going to talk about it at length. I'll be covering them. So there, maybe you can, if you decide to immediately tell them that you don't seem to be interested in listening to me. What is it that you are discussing? And you could actually be creating further, you will be creating more problems for yourself. So you have to really pick your battles. Do you really want to address it? Can you ignore it? Is it really disturbing you, or you are just taking it that it's kind of disturbing you? So you really need to pick your battles carefully, because while facilitating, these are common situations you will get to see. A lot of time your audience will not, agree with you. They will be in disagreement with you. Again, if you get into an argument, if you get into, disagreement, and then you put a lot of energy in proving that what I'm saying is right and what you are thinking is wrong, you are going, haywire. It will. I think I shared with you in one of the sessions. My session was completely kind of hijacked by a set of residents who were member of the Residents Welfare Association, and they really kind of created ruckus. And that's what motivated me to learn how do you really facilitate program effectively, and also how to prevent and control such situation. And after that, I went to take a session for another hospital, and there were very senior consultants sitting, and one of them, right in the beginning, the moment I switched on my projector and I had my first slide, he said, and the caption of the title of my session was Importance and Relevance of Communication Skills in Healthcare Industry. And one of them said, you can't call it healthcare industry. Healthcare is not industry. Had it been me, couple of months ago, I would have gone into argument with that person. And I would have fought tooth and nail to prove that healthcare can be called industry, because it's become now a corporate sector. It's no more just the delivery system, but it's like so. But then I knew I have to pick my battle, and I don't want to derail my program. Very softly I said, "Sir, you don't agree with the title? No, this is not right. Thank you so much, sir, for your feedback. I'll definitely consider." That's it. So you really, during your discussion, a lot of time you will see audience will argue with you. How to handle that? We'll be talking, in the next session. But then handling disagreement, I think sometimes if you don't disagree, there's no need to negate immediately. No, what you're saying is not okay. Maybe what the person is saying from a different point of view. I'm not able to see. So maybe I will ask that person to explain further. I'm not understanding your point of view. Can you please explain? Or maybe I can ask others to give their opinion. What do others say? What do you think is the risk involved in this? What do you think can be the challenge? So when you ask others to give their opinion, most likely if you think that person is making a point that is not correct, audience would give you more reasons not to agree with that. So you don't have to pick the direct battle with the person, but let others also handle it. And then you have to actually smartly handle the disagreement by adding some correct information, appreciating their attempt to reply, and then moving, rather than sticking to that point and making it a battle and then wasting that time. So very smartly we have to handle this situation, and especially when you will be interacting with very senior audience, people who are experienced, who are knowledgeable, well placed. They will have a tendency to challenge your, especially for example, when we say, for example, if I say the patients, they don't come with the mindset to actually fight with you, but because they get upset and then they become aggressive. But a lot of your audience will say, no. They already have on their mind that they don't want to pay the bill. And that's why they create ruckus. Now, see, some of us may have experienced a situation like this, which is true, but we can't generalize it for every patient. But then you can't again go on fighting on that. So handling disagreement is very, very important. So when we talk about the format of presentation, I think one thing we have to remember, limit the segment to 90 minutes. So when I say it is 8 to 10, so I can't go until 11 o'clock. So 10:05, I have to seek permission from my audience that do you want to continue? Do you want? So usually it is 1.5 hours, which is considered good enough to engage the audience. Then you need to give them break. Build activities. This I've been repeatedly saying because that's what is like. It's been almost 2 hours we are talking, but I can see all of you are engaged because there is some activity going on, okay. And then include visuals and hands-on opportunities where people, become interested and engaged. Provide opportunities for repetition and reinforce. You will see some of the things I'm repeating again because those are very important. And I want you to, take them with you so that in your training program, in your future training program, you remember that these were the things we discussed in this session. They are very important. And then projecting enthusiasm, confidence, and encouragement is very important in your session. As a facilitator, if you are not enthusiastic, if you're not confident, you will lose the class. So these things would help you in making your presentation effective. Third point that I want to give is providing evidence, especially with educated audience, professionals, learned people. Providing evidence will consolidate your position as a facilitator. So when you provide facts and figures, some data, some research report, some exhibits, it could be a newspaper cutting or a picture taken on site, or some demonstration where you ask people to role play, or some skit or situation or some videos, some illustrations. So all that will provide evidence to what you are saying. Automatically, people will, have an idea. Okay, this is something that we need to start considering. Some examples of your personal experience or some analogies that you have on your mind. It could be also testimonials or reviews. So what are the usual forms of evidences do you all use? If I may ask, write in the chat box. What are the usual forms of evidences out of all this you are using, or anything even beyond this? Journal reference, yes. Newspaper cutting, guideline statement, yes. I think giving reference really consolidates what you are saying. Yeah, personal experience, yes. As again, often used guidelines, yes. Again, when you share guidelines, they know that it's coming from a authentic source. They are more likely to believe. Then incidents that have happened in recent time, yes. Again, those incidents act as a wonderful evidence to prove your point. Yes, research material guidelines, again, very helpful. Patient's feedback, yes. Again, with patient feedback, it has to be an anonymous quote. It shouldn't be, coming for which particular person it is, because then again, it will be like targeting the person or naming the person that we don't want to do, because the person can get disinterested. Statistics related to the particular scale or content is in same scenario. Yes, I agree. Facts, example, research, data, role play. Then litigation examples. Yes, so the people immediately get to realize, oh, this is not that she's talking out of no base, but has some base on that. Books, news items, sharing incident with anonymity, especially in refresher program. Yes, so that means all these things will help you consolidate your position as a speaker, as a facilitator. And that's the whole idea. I can see some more answers coming in. Experts, expert consultant. Yes. So you would quote them? You would quote them, Dr. Sneha? Is that you're saying?
Rather than direct quotes, maybe add a nuance to what is known in research, or that they believe that this is the better way to do, because
Yes.
not everything can be put in research, right?
Yeah.
Or has not already been studied. So.
Yeah. So then they will have more confidence. Okay, if it's said by such and such consultant or people of that cadre, that means it can be trusted. Yeah, case studies is another good way of working. And you will see most of the management programs will have case studies as a way of teaching and training there. So that will help you in consolidating your position. And then the final is closing the session. So usually, what are the ways that you use to close or close this session? If I may ask you to answer.
A slide with take-home messages.
Okay, take-home messages, that is one thing.
What are you going to change once you go back to your day-to-day life?
What are you going to change? Yes. Quotes, yes, a lot of time wonderful quotes help us. Then review of objective, that's another thing. So that will kind of help you to kind of revisit the objectives and show that yes, we have been able to cover each objective in a systematic manner. And if something is left, then definitely we'll talk about it. Feedback. Yes, feedback, Dr. Manisha, it's not for summarizing. Feedback is more to understand what is their opinion about the session or what has been there.
Yeah. I then realized I wrote it and entered. So sorry.
That's perfectly all right. Then follow. So, Dr. Deepika, can you elaborate on this on follow?
Maybe we can, if in case it requires another session, then we can tell them when do we meet up for the next, and then what is expected in the next session, or what kind of change is expected because of whatever had happened in this session. So that could be done when we are closing a presentation or a training.
So maybe you are trying to say that how are we going to really see the impact of what we have done? So what follow?
Yeah.
Quiz again, Dr. Santoshi, I agree, is a very good way of checking how much your audience has learned. Open-ended question. Again, yes, asking them. So again, if you are going to ask question, yes, by getting answers from your audience, you'll get an idea how much have they learned. Yes, post-test is another way, but post-test is again like you want to see the impact of your study. Summarizing is basically to kind of revisit what you have learned, and kind of in case if you want to re-emphasize on any point, and what is their takeaway. I think that's the whole idea.
We can ask individual persons instead of putting a slide what their key takeaway was, what they found most
interesting,
bulb-on moments.
Yeah. So the whole idea of summarizing is to reiterate what they have learned. So you can ask participant to share at least one takeaway. So when everybody shares their takeaway, almost all points will be covered. Or you throw a challenge. How are you going to use this, or how are you going to apply this in your? What challenges do you see in your applying this? So this is how you can actually close the session. You can planning. So all steps are very important, and please pay attention to all four parts. Nothing should be, left undone or incomplete, because that is where the flow of your session make impact. So I can see one answer in the chat box. 1 second. That says, sharing the flyer for next training program. That's also a very good way. So even when you give a handout, small handout, that okay, whatever we have talked is covered in the handout, and you can read it, hoping that they will revisit and they'll be able to kind of take that. So
do people read handouts, ma'am? I'm very skeptical.
To give handout, not a good
idea. No, do people actually look through the handouts? I don't.
So Sneha, honestly, teaching and training, and it's still in a very infancy in our country. People coming up for training programs with the idea to learn something. Actually, we are all very happy in our comfort. When you tell them you need to learn, you need to upgrade yourself. So I understand, because that's an additional work, and they take it as another responsibility. So they but then those of us who want to visit the content, at least if they have handout, they can revisit the content. Then sharing email ID and website for further queries and communication. That's also a good way of closing the session. In case if somebody wants to contact you or wants to talk to you, and if you share your email that you can write to me, you can. Yeah, Santoshi,
you can ask the question directly from the audience to summarize the content.
Yeah.
So that is that the main points will come, and then you can take it to the conclusion.
Absolutely. But Dr. Santoshi says we should share handout or reference material. Yes. So definitely that will help them, if they want to further read, they'll have some material to read. So I'm going to close it here. There's some more content to be covered. As I said, we'll need to discuss about what makes a successful facilitator. And then also how do you handle disruptive audience. These two things we'll be covering in the next session. And then we'll have the next topic also covered in the next session. So any questions about whatever we have discussed? I know it's past 20 minutes, so I don't know to What do you further?
Ma'am, I think the only thing I want to share is that no, after studying these two sessions, third and fourth, it's really like the topic communication, which we find so simple, and what you have taught us and what you have showed us, I think we require to upgrade our skills with different pedagogies, because every person has only a limited set of skills or uses only limited set of skills. But to be a facilitator, we have to have the full knowledge of the content, the communication itself, the whole knowledge, a lot of research related contents we should have so that we can quote them, and also about the different pedagogies which are used, and we should master few of them which we are comfortable, and try to use more and more to engage, because if it is not engaging and it doesn't bring curiosity, we can't leave an impact.
Absolutely, absolutely. So if I may say, 3 pillars of a successful facilitation, 3 pillars, if I may say. So one of them is your subject knowledge. Nothing can substitute your subject. If you don't know your subject, you will lose ground in front of everyone. That is one thing. And second is your facilitation skills. You need to be thorough with your facilitation skills. Because suddenly a situation might pop up and you may have to really change your way of handling the situation. So you really need to know, how do I really handle that situation? And third is your communication and language skills. That's very important. Because if you will have all 3, the 4th pillar will automatically come in place, and that is your confidence in yourself and in your session. And we are going to cover about all this in the next session, where we'll be talking about the personal attributes of a facilitator. So how do you really become a good facilitator, and what all you should really need to work on? We will talk about this. Dr. Deepika, you have raised your hand. Please go.
Yeah, doctor, just one quick thing. With regards to activities, I mean, you keep doing a lot of activities for every topic that you discuss with us. So what is the source? Like, how do you find the right activity, or like, do you rely on the common resources like Google and things like that? Or do we have to really work on to identify which activity would be effective for a particular topic?
So actually, honestly, you have to keep upgrading your knowledge even about the pedagogies. Like Zoom was never there in our kitty, but now we are using it so much so. So keep an eye on what different ways people are using. Keep experimenting with new ideas. And then also you will start realizing, okay, this will work here. This particular activity will definitely fit here. Somewhere, when you want to start a session, when you start with the video and you ask your audience to discuss, you get wonderful, answers from your audience. But again, there's no definite this thing, this will work here. When you're talking about sources, I can share with you some sources. I have some, PDF available. I can definitely share with you. But at the same time, I mean, those theoretical pedagogies honestly do not help me much. It's what I learn by doing. That I try something and I find it useful, and I see how I can modify and use it in a different. Then slowly your bucket will be filled with different. Thank you for asking. But if you want, I can share a couple of PDFs which will give you a list of. I'll do that. I'll definitely do that. Yes,
Thank
Dr.
you.
Mrs. Neha, you wish to say something?
Yeah, I think this is a catch-22 situation for me. Like, if there's so much more about teaching, the skill of teaching, and especially training, because you have to be really good in order to make this training successful. And for that, you need practice. And to practice, you need to find smaller places wherein you can practice. But going to smaller hospitals, usually they're not interested in getting trainings done. And usually the bigger hospitals are the early movers, the early adopters. They want to get these trainings. Seeing them, the smaller hospitals will go ahead. But then when you go to a bigger hospital, you really have to be very well prepared. So is there some method to speed up this process without wasting too many years?
I would suggest, work with your in-house team.
Okay.
Wherever you are working, if you can start delivering some topics. So you will get an opportunity to, first of all, train your staff.
Yeah.
And you will get a chance to hone your skills. It could be even, pro bono, some training programs that you do. But I think wherever you are, with whomever you are interacting, if you even deliver topics there, it will give you an opportunity to practice yours.
The problem is, I work in a very big hospital which has a lot of visibility, wherein I am a small person. So for me to convince them to let me conduct a training, I should be already proving myself. And if I do a session which is sort of very flat or not very successful, I think it'll create negative evidence rather than positive evidence.
So another thing that I would like to add here that will help you is, so for example, even if I'm planning a session for doctors, before I actually deliver a session for doctors, let me work with the front desk staff, with the nurses, because their expectations and them being judgmental about my delivery is less likely. They'll be more receptive to you, whatever you say. And then slowly, once you have done it a couple of times, automatically message will spread around that, okay, you covered these topics and you are already doing this. And then you will also gather that confidence. So as I told you that I did around 500 training programs, and I had just completed around 100 programs, I can say, and I received a call from the Delhi government that we want to hold Secretary Health, that we want to do a program in the Delhi government office, where we will call all the medical superintendents and deputy medical superintendents of Delhi government hospitals. So 35 hospitals and their medical superintendents and deputy medical superintendents. I mean, for me, it was something I was not prepared for. I mean, I have not expected, I have not anticipated. But then when an opportunity comes, and if you have practiced, see, always you will have to go out of your comfort zone. There will be some, some failure, something going here and there, which is perfectly all right. We keep improving with you. Therefore, I very honestly share my failures with you. That, I mean, nobody is perfect. We make mistakes every day, but that doesn't mean that we are wrong or we are not good enough. We learn from our mistakes and we move on.
Ma'am, we'll have to start from somewhere. So even if we can train the front office people who are the whole day communicating with the public.
Absolutely.
It is such a big asset, because it is not just the doctors or the nurses who require communication. It is the front desk people, because every person who comes into the hospital has the impression of the hospital and the services by how the front desk staff interacts with them. So they should understand empathy. They should understand how.
What is it that actually you have to start working with probably the ground level staff?
Yes, ma'am.
And you will also become more comfortable and confident because you know you can handle it. There is less anxiety, there is less judgment, and there's less worry that if I go wrong,
Ma'am, first of all, there is acceptance. They accept you, you accept them. So when there is acceptance, we are able to deliver.
Absolutely. I think I agree with that. That makes a lot of sense. Yeah. Any other question? Thank you for a very lively discussion. I think you have brought up a lot of points, and that is the purpose, that we should all discuss. And every time I ask my audience, should we take out these two sessions? Are they unnecessary? But then I get the response, no, they're really required, because that helps you work on your facilitation skills. So I am going to share the feedback form in the WhatsApp group, not here, because I don't want to hold you further. It's already 10:30. But please give your feedback either tonight or maximum by tomorrow, because you will have fresh memories of whatever we have discussed. And please give your feedback in that form, and we can have the discussion next week. So next week is 10th. Next Wednesday is 10th. And Yeah. 10th, I will be traveling back from Udaipur. I'm going to travel to Udaipur for a 2 days program. So I will be in flight. The timings incidentally are such that I will be in flight. So can we have this session on the next day instead of Wednesday? Wednesday is 10. So can we have this session on 11?
Yes, ma'am.
Yes,
If
Yes.
everybody is ready.
that's okay. That's okay.
Okay. So same Zoom link we will be using. Zoom will remain same, but instead of
Madam,
Wednesday,
sorry to interrupt. I'll be traveling on 11th for the conference for 4 days to Kochi, ma'am. So I
okay.
won't be able to attend on.
So if it is
11th.
okay, I will share the recording with you. And in case if you can join and just even stay with an audio if you think video is not
Okay.
possible. Even
Okay.
that would work. Even that would
Okay.
work.
I'll try that. No problem. Thank you.
Had I not been in flight, because on the previous day I'm going to be at Udaipur, so the other batch I'm going to cover there while being in the hotel. But this time, incidentally, the same time is my flight, 8 o'clock. So I will not be able to hold this session. So therefore, I'm requesting we'll do it on Thursday. Thank you so much. Thank you for your time and your attention and participation.
Thank you, Dr.
Thank you, ma'am. Thank you, everyone.
Thank you. Bye-bye.
And
Good
take
night.
care, Dr. Neha.
Thank
you.
Yeah.
Thank you, ma'am.